Diverticular disease is a fairly common condition of the colon, and we see it increasingly so as we get through life. So one rule of thumb is 75% of 75-year-olds may have this condition in the Western world. But fortunately, most people live with this condition with very few problems and rarely need hospitalization. From the information that we have so far, this wasn't an acute emergency condition, which can happen in diverticular disease, whereby the actual colon becomes inflamed and at risk of perforating. But I think this sounds more like chronic diverticular disease, which has led to bouts of pain affecting the quality of his life, reducing his ability to be as active as he is. And that has resulted in a narrowing, meaning it's a planned surgery or semi-planned surgery. And we know from the literature that all semi-planned surgery has better outcomes than emergency surgery because you're able to control many more of the conditions and variables. So I would have expected that he would have had a colectomy, which is excising that portion of the bowel which was diseased and narrowed, and then joining the two ends together to allow passage of stool through the colon without impediment. The biggest risk following surgery like this is those two ends can come apart, and we don't have details as to whether or not he has been fitted with a temporary stoma procedure so that waste can be diverted away and allow this joint to heal. But that risk can be up to 10% in this part of the colon, and that's really what the doctors will be looking for over the next few days, along with other issues of clots in the legs or infection, which are common to any major surgical procedure. As we get older or other medical conditions affect us, they clearly influence the outcomes of complex abdominal surgery or any complex surgical procedure. And I think in the case of having previous problems with the lung, there is always a concern after major abdominal surgery of the risk of getting a chest infection. And the reason that happens is because the incisions that are made to get into the abdomen, even if it's done in a keyhole manner, can often lead to patients not wanting to take a deep breath because it hurts. And the bigger the incision, the more it hurts. And if you don't take that deep breath, and the lungs can't expand fully, and they can't get rid of a lot of the fluid or any potential infection that may be developing. So in the presence of already having lung treatment or scarred lungs or surgery on the lungs, that can become an additional worry in the early days of the recovery following surgery. The recovery from this type of surgery is partially dependent on how the surgery is done. So in my hands and many colleagues around the world, this is often done as a keyhole or a laparoscopic operation. But technical difficulties or other factors which aren't known before surgery may mean that a more traditional open surgical approach with a bigger incisions required. But either way, I wouldn't expect him to be in hospital for anything really more than 7 to 10 days at most. And if done in a keyhole way, that would have been slightly sooner, and with the traditional incision a little bit longer. But the progress is very much dictated on how the bowel works. So once he's up and awake, and providing he's not feeling sick and in not too much pain, they will have him eating and drinking relatively soon. And once there is evidence of stool being able to go through the system and thereby confirming that there is no real problem with the join or the new join of the bowel ends, then that's when it's time to think about leaving hospital and any further convalescence at home. I would expect that he, from all reports, is awake and talking, and his mobility will begin to improve over the next few days. And I suppose he will have to reduce to some extent his activities. He's obviously a very active man. And even if the surgery, and he recovers from the surgery in hospital quickly, the physiological trauma of the procedure does take a few weeks to get over. And I would suspect that he wouldn't be back to doing his duties within the month.